ready to share treatment tips with those who care at the Caregiver Call Center.
I will care for caregivers today.
Hey, Greg. I want to make sure I'm doing the most I can for my loved one. What can I do to help prepare for their next doctor's appointment? Thanks for your help.
All right, you're not alone. There are a lot of people who feel exactly like you do. As a long-term caregiver, I've been to my fair share of appointments. But I know someone who's been to a lot more doctor's appointments than you and me combined. A doctor. Dr. Labiner. Dr. Labiner.
Hey.
Hey, I just got a message and I need some advice.
Let me help.
All right, let's go. Oh, thank you for your time. I just got this great message from a caregiver. So they're concerned about making the most of their doctor's appointments. And I know you have a lot of experience in that, obviously. So what tips do you have for them to prepare?
So I recommend that patients kind of break it up to both what's happening before their visit and then during their visit too.
Okay, so it's kind of like, I don't know, a little appetizer before the main course kind of thing. I like to think in food terms. That's really great. So what would you do before the appointment to prepare?
So before the appointment, the best way to start is to think about what your goals are. Seizure reduction, always going to be the #1 goal, but you may have other goals that go beyond that too. There really isn't a right or wrong answer. It's about what's important for you, your life, and then what feels good for your loved one.
So the goals one caregiver might have are going to be different from the goals of a different caregiver.
Absolutely. So everybody's goals are going to be a little bit different based on your lifestyle and kind of what your loved one needs. Also, reach out to your provider beforehand. If there's something specific that you want to talk about or a specific question that you want answered during that visit, that way everyone's on the same page beforehand.
That's really clever. Okay, so that you can go into the appointment and just hit the ground running.
The other thing to do is to bring people with you. Then you have 2 people listening, and that can be really helpful to make sure everybody knows and can ask questions.
Okay, so based on what you're saying, so a caregiver's network is really important, right?
Absolutely. Because the network isn't just the primary caregiver, it's anyone who might be caring for them. And depending on the age, right, could be the school nurses, could be home health nurses, could be other family members, friends, anybody who is really part of that journey with your family, then is going to be part of that. And different people are going to think about things different ways and listen to things in different ways and have different questions. And being able to have that perspective is really, really helpful during a visit. And then when we talk about what to do and what information to bring with you too, we like for families to bring their seizure logs. And that is something that I love for all the families to be doing at home. Because otherwise we may not be able to see the trends that we're looking at, what may be triggers or patterns to seizures, but that can really be helpful too because it brings that information without you having to think back about what happened a month ago.
So what should happen during the doctor's appointment?
Write down all the things that you can, especially if you came with those specific questions, take notes, write it down, and that helps people who weren't able to be at the visit too, because sometimes we may not remember exactly what was said, but if you have it written down, then you can always reference it.
Anything else that a caregiver should know?
The other thing is ask any question that you have. I think people sometimes worry like, oh, I don't want to waste my doctor's time. I don't want to say something silly or make them think that I don't know what's going on. So they worry that the question's going to sound like they are a little clueless, and that's not it at all, right? You want to have all your questions answered, no matter how you formulate them. We're all one team, and being able to really approach it that way is helpful.
Yeah, and it says right here, there are no bad questions.
Absolutely.
Yeah,
and I tell every single patient too, it's probably not the first time, nor will it be the last time I've heard that exact question.
Well, I cannot thank you enough for visiting the Caregiver Call Center. Dr. Labiner, your perspective and your wisdom, it just helps all of us caregivers feel better and more confident going into a doctor's visit. So thank you.
Absolutely, happy to help.
And thank you for watching.
Important safety information and indications. What is the most important information I should know about EPIDIOLEX, cannabidiol? Do not take if you are allergic to cannabidiol or any of the ingredients in EPIDIOLEX. EPIDIOLEX may cause liver problems. Your doctor may order blood tests to check your liver before and during EPIDIOLEX treatment. In some cases, EPIDIOLEX treatment may need to be stopped. Call your doctor right away if you start to have any of these signs and symptoms of liver problems during treatment with EPIDIOLEX. Loss of appetite, nausea, vomiting, fever, feeling unwell, unusual tiredness. yellowing of the skin or the whites of the eyes, jaundice, itching, unusual darkening of the urine, right upper stomach area pain or discomfort. EPIDIOLEX may cause you to feel sleepy, which may get better over time. Other medicines, for example clobazam, or alcohol, may increase sleepiness. Do not drive, operate heavy machinery, or do other dangerous activities until you know how EPIDIOLEX affects you. Like other anti-seizure medicines, EPIDIOLEX may cause suicidal thoughts or actions in a very small number of people, about 1 in 500. Call your doctor right away if you have any signs of depression or anxiety, thoughts about suicide or self-harm, feelings of agitation or restlessness, aggression, irritability, or other unusual changes in behavior or mood, especially if they are new, worse, or worry you. Take EPIDIOLEX exactly as your doctor tells you. Do not stop taking EPIDIOLEX without first talking to your doctor. Stopping an anti-seizure medicine suddenly can cause serious problems. What else should I know when taking EPIDIOLEX? The most common side effects of EPIDIOLEX include increase in liver enzymes, sleepiness, decreased appetite, diarrhea, fever, vomiting, feeling very tired and weak, rash, sleep problems, and infections. EPIDIOLEX may affect the way other medicines work, and other medicines may affect how EPIDIOLEX works. Do not start or stop other medicines without talking to your doctor. Tell your doctor about all the medicines you take, including prescription and over-the-counter medicines, vitamins, herbal supplements, and cannabis-based products. What additional information applies to women? If you are pregnant or plan to become pregnant, EPIDIOLEX may harm your unborn baby, and medicines like EPIDIOLEX may be passed into breast milk. You and your doctor will decide if you should take EPIDIOLEX and about the best way to feed your baby while taking EPIDIOLEX. If you become pregnant while taking EPIDIOLEX, discuss registering with the EPIDIOLEX Pregnancy Surveillance Program, 855-272-7158, or EPIDIOLEXPregnancyStudy.com, and the North American Anti-Epileptic Drug Pregnancy Registry, 888-233-2334, or AEDPregnancyRegistry.org. The purpose of these registries is to collect information about the safety of anti-seizure medicines during pregnancy. What is EPIDIOLEX cannabidiol? EPIDIOLEX is a prescription medicine that is used to treat seizures associated with Lennox-Gastaut syndrome, Dravet syndrome, or tuberous sclerosis complex in patients 1 year of age and older. It is not known if EPIDIOLEX is safe and effective in children under 1 year of age. Please read the EPIDIOLEX medication guide and instructions for use for additional important information. You are encouraged to report side effects of prescription drugs to the FDA. Visit www.fda.gov/medwatch or call 1-800-FDA-1088. You may also contact Jazz Pharmaceuticals at 1-800-520-5568.